Hello and welcome to Supplemental Healthcare's first ever roundtable. My name is Jim Burris. I'm the Senior Division Staffing Manager here in Dallas with our school's Center of Excellence. Back in March, as we're all super aware, our worlds were sort of turned upside down, a little on its head, if you will, due to COVID, forcing schools to pivot into some remote learning atmospheres. Thankfully, we were able to partner with our school districts to find solutions towards maintaining the continuity of essential services our healthcare professionals, such as yourselves, provide. With me today, we've got our SHC school ambassadors who have joined us to shed a little bit of light on how they were able to adapt to their new surroundings and offer maybe a little bit of advice that may, to those that may find themselves in a similar situation if the need to pivot arises again. So with that, let's jump over to the stars of the show and have our ambassadors introduce themselves.
Hi, I'm Sara Young. I am an occupational therapist. I have 6 years of experience now, and I've been with St. Louis Public Schools and Supplemental for 5 years now, and it's been going great.
Hi, my name is Tina Kollar. I'm a licensed specialist in school psychology in the Dallas area, and I'm currently with Little Elm ISD. I have 24 years of experience in the public schools, ranging from preschoolers all the way up to high school, and sometimes even 21 years of age. I've been with Supplemental Healthcare for 2 years now.
My name is Taylor Yarbrough, and I am a speech-language pathologist in the Baltimore County Public School Systems. I'm actually a recent graduate last year getting my master's degree, so I'm completing my clinical fellowship. And I have started at Supplemental in January.
Brandon Buckendorf. I'm a speech-language pathologist as well. I've been practicing for, 15 years now. So that makes me very old. I've been with Supplemental for 4 years, and I'm a supervisor with Supplemental, and I serve in the St. Joseph School District. I wear several different hats. I'm a department co-chair with the district, and then I help with kind of the staffing coordinator for Supplemental. And then I have some speech-language pathology assistants I supervise. So it's a really unique job, and I'm really thankful.
Well, fantastic. Lots of experience there, both with Supplemental and outside of it. So we appreciate all of you guys' insights that you're bringing to the table. It's certainly going to be helpful, and looking forward to hearing some of these fun answers. So with that, let's just get right down to it, to our first question. Remember, if you say something, or if you've got the same answer as one of your other, I guess, coworkers here, don't hesitate to answer the same sort of way. I feel as though that even though some folks encounter the same situation, we might have different ways of finding a solution or explain it in a way that might resound to somebody new. So with that, let's get going. With the interruption of COVID-19, what was the biggest challenge you encountered during this last school year? And we'll just go in the same order that we introduced ourselves. So Sara.
So for me, the most stressful thing that I found was all of the changes in documentation we were getting. Supervisor heads and department heads were meeting all the time, and we had constant weekly changes. It felt like what I did one day and my documentation was completely different the next day, and just navigating all of that and making sure I was doing things correctly so that we could maintain compliance was probably the most stressful part. Eventually it became a little more consistent, but at first that's definitely something that stands out to me, just kind of being able to maintain and go with the flow and be like, you know what, that was yesterday, today, let's start the new form and do what I need to do. So that was probably the most stressful part.
Okay, my biggest challenge this school year, once we moved into the COVID aspect, was the Wi-Fi in my own home. That was a huge challenge for me initially when I started getting on Zooms right away. The first day I was having some serious and significant connection problems. So I had to move quickly, call my local carrier and get that updated, which was a good thing because it actually ended up being $15 cheaper a month because my plan was so old. So that was my biggest challenge during the COVID school year.
I would say my biggest challenge was having limited resources at home, trying to just adapt to figuring out what to do for the kids, because I use so many hands-on activities at the school, as well as adapting to the student schedules. Scheduling was kind of hard for me because everyone's schedule is so different, and I'm used to just pulling kids out of their classes and seeing them in a group. So trying to figure out how to schedule that was pretty difficult for me.
Yeah, and you know, for me, I think it would be some of like what Sara and Taylor mentioned, just with it was so fluid. Like, so what was being required yesterday? Well, that's not. Did you get the memo? That's not what we're doing today. And then not knowing, okay, what are we going to be doing next week? Not knowing how long this is going to go on. Like, are we going to go back to school? You know, and having to, there was nothing that worked the same for one student. If Zoom was working, some students didn't have internet. Some students just didn't have the parents at home to help them get online. So there wasn't a single answer that worked for everybody. So I would say, yeah, that was tough.
What I'm sort of hearing from everybody was the logistics. The logistics were really what it came down to, is that, you know, whether it was, you know, updating the Wi-Fi at home, which Tina and I worked together, so I know, I'm sure the kiddos probably were just super happy about that too there. Or just simply, you know, resources at home or documentation. You know, those things are, you know, what we would all sort of consider as must-haves. And to get into a situation where they're like almost become nice-to-haves, just for, even if it's just for a little bit, is definitely a challenge. And then I think, Brandon, I you know, what you said is really what sort of was my thing, was you know, the unknown. You know, we still sort of live in an unknown. Like, it's, you can't, what do you plan for? So definitely all four of you guys hit on topics that I think that everybody sort of can relate to. So fantastic insights. Let's maybe your top two go-to tools or resources that you utilize to overcome the pivot into remote / innovative, you know, type of learning. Whether that's a top tool that was helpful for you, or maybe it was a tool that helped with you know, getting your students and parents to the table to where they felt comfortable in the same fashion that they might, you know, back at home or back at school.
So my favorite tool, and I use this throughout the school year, whether I'm home or at school, is Tools to Grow. It's a great therapy resource. It has activities broken down by specific skill area. They have different themed activities, which are super fun for the activities, and you can make it seasonal. It's seasonal activities as well. So I find kids are really motivated, and those activities are a little more fun for them to work on their goals. And then it's not really a resource. I've kind of been a resource hoarder over the past couple of years since I've started, kind of compiling different resources from websites and treatment activities that I have on a disk. So it was pretty easy to access those activities and send them through emails, and then just, you know, describe how to modify and adapt those activities per student. So that came really in handy, and I was happy that I did that over the past couple of years. So it made the transition a little bit easier.
One of my top go-to tools was actually Zoom, because looking at it from my perspective and what I was asked to do, I still had to provide counseling through Zoom. I still had to attend meetings through Zoom. I was conducting evaluations through Zoom. So, you know, those were some big challenges to overcome and figure out how to accomplish all that at the same time. So that was my first go-to tool. The second one's very personal. My second tool was actually my wardrobe, because I wanted to feel like I was still in the building. I wanted to feel like I was still projecting this certain image and representing the company. So I wanted to make sure that when I was on Zoom, I still looked professional. I still looked like I did in the building. So I made sure I wore my work tops. I had on my Zoom lipstick, and I keep it by me all the time. So for me personally, that's very personal, but going back to the wardrobe, that was just really important to maintain that professional image.
My go-to tool was Google Meets. It was pretty easy for my students to access, and I was able to see them in groups, as well as leave homework for them to get on and access by themselves. So I use that a lot, as well as Teachers Pay Teachers. I've used that throughout. They have a lot of worksheets for my students, because I'm at a middle school and high school, so it's easy for them to just kind of find a lot of worksheets and resources for them that it's pretty easy for them to access. So Teachers Pay Teachers and Google Meets were my go-to tools.
So for me, I would say Teach Town was a resource that we piloted during COVID. It's an online platform where you can assign speech and language activities that the parents, that the kids can actually do on their own. So we had some families that really liked that. Again, it didn't work for everybody, but it was one tool that that was really helpful. The other one is kind of like Tina was saying. This is like pretty more personal. It was for me. I had to start my day getting centered. Being in leadership during this time. I don't wish that on anybody. No. I mean, it was a time to like really step up, and I had to get back into meditation. I had to use, which I used to meditate a long time ago, and I just kind of got lazy with it. But when this whole thing hit, I was like, all right, yeah, I need some Zen. So I started using Balance, which is kind of like Headspace, and I started using that, and I found that super helpful.
I gotta say I can relate with all of you in those settings or those sort of situations. A lot of folks, whenever they hear that question, list a couple of your go-to tools. I think that it might imply simply what helped you with your job, and it's got to be a work-centric type of tool. But both Tina and you, Brandon, there talking about things that helped you as personally, I think is just as, if not more so, important a lot of times. I mean, they say, whenever you're on an airplane, back when we wrote those, whenever the masks come down, you got to put your own on before you help out the one next to you. And I think that could be, talked about here as well, is that, if you guys aren't in a great place, a great mindset, you yourself, then, kids pick up on that. So we talked about pivoting into innovative and remote learning. I think those are some pretty innovative ideas as to how to go about things, plus some really straightforward, with Tools to Grow and Teachers Pay Teachers and Teach Town, all really, really great resources. And yeah, I had no idea what Zoom was 6 months ago. So, and now it's everywhere. So anyways, fantastic stuff. Jumping right over, what advice would you give somebody that's maybe new to schools, or maybe wasn't, within a school setting last year, or simply maybe was, and, simply put, what advice might you give somebody that's looking to walk into a school situation this upcoming 2020-21 school year?
So when I started, I had no clinical experience in schools, and it was very overwhelming. You're learning all of those new systems and just learning how the school setting works and how your role, your role in the school setting. So I would say the biggest thing is that not everything has to be learned in that first week. Like you don't have to know what you're doing right away. It's kind of a ever learning and growing process. I still ask questions to team leads and other therapists when I'm unsure about situations. So ask lots of questions. I will say for St. Louis Public, we have a great supportive group of therapists. And when, you have those interactions in those buildings, ask questions to those therapists. Everybody's very kind and willing to help. So ask questions and don't be too overwhelmed with learning everything at once.
I'm just thinking about this as I went through the beginning stages of COVID. One of the things I encountered with parents, because I was having a lot more conversations with parents, it was interesting because when you're in the building, as I reflect back, I had more conversations with administrators, with teachers, with other specialists, but when it shifted to at home on Zoom, I started having more conversations with parents. I could get in touch with them easier. They were actually answering the phone. I wasn't, having to leave a voicemail. So that was really refreshing. I was able to establish more trust and rapport with parents. But what I discovered in that was like the parents were so overwhelmed. They were stressed out. They're like, my kid's not learning anything. Like, what do I do? They're looking to me for answers. So if giving advice going into this, I would just have some idea of what you're going to say to parents, because that's going to happen again. You're going to be put on the spot. They're looking to you to guide them, to give them advice. And I really relish in that opportunity. And I felt like I did a really good job of doing that. So that would be one area I'd really focus on to be prepared for. The other thing I discovered, I would encourage you to really look at the remoteness, the Zoom opportunity as being a place where you can have more flexibility. Look at it as a way to find more ways to be efficient, because I found that I was able to document more things more efficiently. My handwriting was neater because I wasn't in a hurry to go from, my office to get to this observation, to test a kid or talk to a kid or talk to an administrator. So my notes were a lot neater. So it was an opportunity to really streamline some of my own processes that we normally just kind of fly by or throw together. So that was a good opportunity to be flexible and efficient that way. So that would be my take from it.
This was my first time in the schools, and I was in a middle school and a high school. So it was very overwhelming for me, kind of what Sara was saying, just it was overwhelming, but I learned that you grow over time. It's important to ask questions, use your resources. I was finding that I was kind of going out of my way and going to Target a lot and the dollar store to get different things, where instead of like looking at my school and going to the library or asking teachers for resources first, because the school has so many resources that you can use. So just relax, ask questions, don't get too overwhelmed, especially if you're in middle school or high school, because it can seem a little intimidating at first. But I just found just getting comfortable with other team leaders and teachers helped a lot, and they were there throughout the whole time to help me.
For me, I would say, I would echo kind of what Sara had said. Just so important that you're willing to just put yourself out there and ask questions. It's a time right now where I feel like we can't be governed by the unknown. So it's a time where we have to step out there and try new things, try teletherapy, try some of these different programs. You might be surprised at how well you like it. And if you don't, it's probably going to change tomorrow. So that's a plus. Yeah, I just feel like it's not a time where you're going to base the decisions for the rest of your career off of right now. This is a very unique period. And I feel like we're all learning a ton. Like, this is such an opportunity for us to learn. I feel like it's going to be useful for us moving forward.
I think what I heard, the vast majority of it is, if I could just pull one word out of that, is vulnerability. I think that, being vulnerable with yourself to ask those questions, to slow down, to acknowledge that it's okay to, woo-saw, relax a second, that all of those things are okay. And then sort of understanding that you've got to prep yourself to be ready, because, the parents are not going to come with that same level of centeredness, that calmness that you have to show yourself, and utilize the resources that you've got. Don't try to reinvent the wheel. They've got resources in place. We talked about a few of them just a minute ago. Use them, leverage them, put yourself in a situation to succeed and learn from your mistakes, because you're going to make them. We make them every day. So I think, going back to that is the vulnerability of understanding that we're all in this together, and no one is going to come out of this, just saying I made no mistakes. It's just one of those things that we get to embrace. So awesome stuff. Last question here, and it's sort of an all-encompassing. What is your biggest takeaway? What do you feel as though that you've gained or you've garnered from this experience that you look forward to taking in? Because I think we've hit on a few of them. So if it's okay to repeat yourself on any of those things.
My biggest takeaway was the interaction I got to have with parents and grandparents that, unfortunately, there's not enough time in the day to reach out and talk to them. I'm talking to teachers mostly, and it was just really amazing to get to know these families and get a better idea of where this kiddo comes from. And I got to educate on OT and, why it's important and what we're working on, and just to provide those kind of simple activities they can do at home with at-home items was really awesome. And my biggest takeaway from now on is to try to make more of an effort when we're back in that school setting, to reach out to my parents and to have that relationship. It's only going to help that child make progress if they're working on some things at home too. So, increasing that communication and trying to have that carryover throughout the school year is what I'd like to continue on.
My biggest takeaway was not allowing this to be an obstacle, but looking at ways to overcome things that popped up, or just looking at the big picture. How can I overcome this? How can I make this better? So I just want to encourage everyone, don't let the barrier of being remote get in the way of what you need to do or what you need to do for the families or the children. So it did provide an opportunity, like I said before, to be very efficient, to allow for more communication with parents. So that was a big takeaway for me.
For me, just learning to adapt and using so many different resources. I kind of had to get creative a lot of times and figure out different things to do for therapy, use some resources that the students had at home. And kind of what Sara was saying, I was able to talk more with parents and educate them as far as what we've been working on during the school year and some things they can do at home as well with what they already have. So kind of just using different resources instead of sticking to the same things that you're familiar with and just getting creative.
I would say for me, I would kind of echo what Tina touched on. I'm reading a book right now called The Obstacle is the Way by Tim Ferriss. Excellent read. I'm finding during this time, I'm having to it's easy to think about what's going on in a negative light. Like, this is challenging. Like, it's for real, it's challenging. Okay, but what about it is what's positive, you know? Like, what can I learn? What can I learn about myself, you know? And I'm finding that it's causing me to have to reach deeper, to reach deeper, to find inner resource in myself that I didn't know that I had. And that's pretty cool. For me, I've had to really focus on self-care, get back to some of the basics of, making sure that I'm exercising, getting back to eating, getting back to nutrition, getting back into getting that space in my head. So kind of like Jim had said earlier, like we have to have the mask on ourselves if we're going to help other people, and that's our job. Our job is to be helping kids and other professionals. So we got to be fed, we got to be nourished in order to do that. So I can't give out of an empty bucket. My bucket has to be at least halfway full, hopefully more than that, but it can't be empty. So anyway, that's kind of what I'm learning.
Whoa. I mean, you guys, you sort of all hit on the same theme. Keep it simple, keep it human. The human interaction with talking to the parents and keeping that relationship, because, they're almost like your, in a lot of ways, your partner in getting the students or the kiddos to where, we hope they can be. So utilizing them and leveraging them to make them feel included is only going to benefit the kid and yourself and them. So that's really, really, neat to hear, that something so positive could come out of something so seemingly negative. Again, I really want to emphasize how inspiring all of this stuff is, to me, as somebody who, manages a team of recruiters who's been recruiting for as long as I have. It's just, it's just one of those really special things. You get to see whenever you sort of pull back the curtain, that it's not just about the contract. It's not just about the radius of how far you'll go. It's about, how can we put you in a position to make sure that the kiddos are seen and the therapy is provided. So thanks again for all of the great words. Thanks for the great advice. And thanks for bringing a really refreshing view to what it is that you guys get to do on a day-to-day. I really appreciate it. So with that, goodbye. Hope you guys have a good rest of your day, and we will hopefully talk soon, very soon.
Thank you. Bye, everyone.
Thank you so much.
Bye, guys.